The federal government is not some nameless, faceless entity. It's made up of individuals and people like you. You have been in our federal government. So, you know, we have to work with our federal government. And people who cannot afford insurance are people who get Medi-Cal and later on Medicare. Now, I can afford insurance, but I do not have insurance because I've been denied insurance 3 times of my application, each time with a letter from my physician saying that I'm perfectly healthy. I have some common thyroid issue or something like that. So I'm not covered. So, and this to me seems to be rationing by insurance companies. And talk about death panels, it seems to me that the insurance companies are the ones that are the death panels. But my question to you is, okay, you're interested in reform, so besides tort reform in terms of medical costs, what is another idea that you have, or do you have any other ideas about bringing down medical costs? Besides increasing, what you say, increasing competition between insurance companies, what else would you suggest? What else does your party have that would bring down the
okay, I think I understand. You want me to say what else? I think I have that. You know, there's really a number of things. Again, I mentioned that earlier. Let me mention another big thing. And there's a lot of areas in our society today that we can look in the areas of healthcare that is working well. Little pockets here or pockets there that are working well. That we can see these as examples and say, hey, that's working so well, why don't we try expanding this? One of those, anyone here work for Safeway? But anyway, Safeway has a plan. It's not just them. There's other groups, I believe Target and a few others, who are self-insured, whose health care, just like everyone else, costs have been going up astronomically, maybe 7, 8, 10, 11% a year that we've been hearing from so many here. What they did, said, we've got to get a handle on this. They did this a few years ago. They're self-insured. They said, what we're going to do when you begin work, and all our employees, we're going to have a physician see them, check them out, give them a physical. If someone is overweight, they're going to give a program for them if they're obese. If they have high blood pressure, high cholesterol, they check them, they put them on medication. And or they offer that to them. They don't make them as a carrot. And they say, right now, your health insurance is this amount that you're going to be paying for the year. However, if you get on this program and take this medication to help bring your blood pressure down and others so that you can be healthier, so that the chance of having a heart attack or a stroke or something isn't going to be there, that we'd be paying for your insurance. We're going to give you a rebate of, say, $130 or some amount at the end of the year. Now, if you're not able to do it, then you continue paying. They've been able to level off their health care costs. The rest of the nation going up, level off. This is another example of a number of things, and there's several dozen things like this working together. No one silver bullet, but working together to get a handle on this out-of-control healthcare costs we have.
Congressman Herger, it seems to me that one measure of a just society is how we take care of those least able to enjoy the fruits of life. How many of the 40 million Americans currently without health insurance would be covered under your plan?
Now, I don't have a plan, but let me tell you a plan that I'm supporting. And this is a big issue, what this gentleman said. If you're young, which has only been a few years ago for all of you sitting out there, but when I think back, you know, when I was in my 20s or so, boy, I didn't think I was ever going to get sick, you know, just as healthy as you can be. Why should you have health insurance, right? Why should you pay for it? So that's one of our problems. People don't get into paying. Part of that 47 million are groups in there who don't think they're going to get sick. We have another big group who's making a lot of money, but they're young and they don't think they will. Another point that can bring down health care costs that the lady asked over here is just to allow right now insurance companies, if your child is in college, you can, normally when they're 18, they're not on your insurance plan anymore. 21. Well, my understanding is, and every state is different, but many states is as young as 18 or 21, or if you're in college, maybe 23, but just allowing, and there's many of our kids today that seem to stay around till they're 25 or so. That's not unusual anymore. But just if that is the case, for whatever reason, going to school, whatever the reason, would allow insurance companies to be able to cover them till they're 25. Number one, it costs the insurance companies very little because they don't get sick very much. But it also takes a number that were on the uninsured, puts them on the insurance rolls. That would be one of many things I believe we could do. Right now, and they're not, states regulate what age you go off. And many, it depends, but almost no state allows it to 25, which is something I would recommend. Yes.
Congressman Herger, thank you for this opportunity to address you. My name is Dave Enlow, and I just have a simple question. We've heard much about the public option by many people, and our President Obama and others have, many of them have told us that we can keep private plans as long as we want to, that there's no problem there, no one will be forced on. My question is, if we are for any reason ever put on the public option, how easy is it, and is it possible even to go back to private whenever we choose?
I don't know if you already know the answer to that, and you're just a rhetorical question, but I'm going to tell you, the way this plan is set up, if you ever go into public auction, you cannot go back. You cannot go back once you change. And the way it's set up, again, these nonpartisan groups have estimated that there would be as many as 120 million that would lose insurance right away because insurance people would not cover them anymore. It would be cheaper for a company, particularly a small business, just put them all in the government plan. It'd be, which the government only pays a certain percentage of cost to hospitals, then it would be, their estimate is between 3 and 5 years, there wouldn't be anything but the, and I like, you notice how they call it the public plan. You know, you think of a public utility that's popular. It's not a public plan, it's a government plan. It's basically a government takeover plan. And if you don't believe that, look at what one of the most powerful chairmen in the House, Barney Frank, said in an interview.
Known pedophile.
He said, this is just something in line to move to a one-payer plan, and that's what he even admitted. Thank you for your question. Okay, we have time to take, we're out of time, but we have time to take 2 more on each side.
Mr. Herger, do you consider the government involvement in health plan to be constitutional or unconstitutional?
Good question.
I have, you know, this question has come up earlier. It's come up here. I'm